What is bipolar disorder and how is it diagnosed? Bipolar disorder, formerly known as manic-depressive illness, is a mental health condition characterized by extreme mood swings that include emotional highs, mania or hypomania, and lows, depression. These mood fluctuations can significantly impact a person's ability to function in daily life, affecting relationships, work, and personal well-being. Bipolar disorder is a lifelong condition, but with proper treatment, individuals can manage their symptoms and lead fulfilling lives. The condition is often misunderstood and misdiagnosed, which is why early detection and proper diagnosis are crucial. In this article, we will explore what bipolar disorder is, its types, symptoms, and how it is diagnosed. 1. What is bipolar disorder? Bipolar disorder is a mood disorder that causes extreme mood shifts that are much more intense than the typical emotional ups and downs people experience. These mood changes are not just about feeling happy or sad, but involve extreme states that can affect energy levels, behavior, and thinking patterns. Manic episodes. During a manic episode, an individual may feel excessively energetic, euphoric, or irritable. They may engage in risky or impulsive behavior, such as spending sprees, reckless driving, or making decisions without fully considering the consequences. Symptoms of mania include extremely elevated or irritable mood, increased energy or restlessness, racing thoughts or pressured speech, decreased need for sleep, feeling rested after only a few hours, impulsive or reckless behavior, for example, overspending, risky sexual behavior. Hypomanic episodes. Hypomania is a less severe form of mania. Individuals experiencing hypomania may feel highly energetic or productive, but they can still function in daily life and are less likely to engage in dangerous behaviors. Symptoms of hypomania include elevated mood, increased energy and activity, more talkative than usual, mildly impulsive behavior, less need for sleep. Depressive episodes. During a depressive episode, a person with bipolar disorder may experience intense feelings of sadness, hopelessness, or worthlessness. This can lead to loss of interest in activities, changes in appetite, and difficulty concentrating. Symptoms of depression include persistent feelings of sadness, hopelessness, or emptiness, loss of interest or pleasure in most activities, anhedonia, significant changes in appetite or weight, fatigue or loss of energy, thoughts of death or suicide, difficulty concentrating or making decisions. 2. Types of bipolar disorder. Bipolar disorder is categorized into different types based on the severity and frequency of the mood episodes. There are 3 main types of bipolar disorder. Bipolar disorder. This is the most severe form of the condition, characterized by manic episodes lasting at least 7 days or by manic symptoms that require immediate hospital care. Depressive episodes often occur as well, typically lasting at least 2 weeks. Individuals with bipolar disorder may experience mixed episodes, where both mania and depression occur simultaneously. Bipolar II disorder. Bipolar II disorder involves hypomanic episodes, less severe than full-blown mania, and major depressive episodes. People with bipolar II often have depressive episodes that are more frequent and severe, with hypomania causing mood changes that don't significantly disrupt their life. A diagnosis of bipolar II requires at least 1 hypomanic episode and 1 major depressive episode. Cyclothymic disorder. Cyclothymic disorder involves numerous periods of hypomanic symptoms and depressive symptoms that do not meet the criteria for a full manic or depressive episode. These mood changes last for at least 2 years but do not cause severe impairment in functioning. While the symptoms may not be as extreme as in bipolar I or bipolar II, cyclothymic disorder can still lead to significant emotional distress and challenges. 3. How is bipolar disorder diagnosed? Diagnosing bipolar disorder is a multi-step process that involves thorough evaluation by a healthcare professional. Since there is no single test for bipolar disorder, doctors rely on clinical interviews, symptom assessments, and medical history to make a diagnosis. 1. Clinical interview. The first step in diagnosing bipolar disorder involves a detailed clinical interview. The healthcare provider will ask about the person's symptoms, personal history, and any family history of mental health disorders. They will also ask about the frequency, duration, and intensity of mood swings, and whether these mood episodes have affected work, relationships, or other areas of life. The provider may also assess the patient's mood patterns, asking about periods of high energy, mania or hypomania, and periods of depression. 2. Diagnostic criteria from the DSM-5. To diagnose bipolar disorder, the doctor will refer to the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, which outlines the specific criteria for diagnosing the disorder. The DSM-5 requires that symptoms meet certain criteria for mania, hypomania, and depression to be classified as bipolar disorder. For bipolar I, the person must have had at least one manic episode and possibly one depressive episode. For bipolar II, the person must have experienced at least one hypomanic episode and one major depressive episode. 3. Ruling out other conditions. Bipolar disorder shares symptoms with other conditions, such as schizophrenia, borderline personality disorder, substance use disorders, and anxiety disorders. A thorough evaluation is necessary to rule out other conditions and confirm a bipolar diagnosis. This may involve blood tests or brain imaging to check for other underlying medical conditions that could be contributing to mood changes, for example, thyroid disorders or neurological issues. 4. Observation of behavior. Healthcare providers may also rely on observation of the person's behavior over time. Because bipolar disorder often develops in adolescence or early adulthood, it can take time to fully understand the pattern of mood swings and their impact on the individual's life. Sometimes, a long-term relationship with a therapist or doctor is necessary to track the progression of the condition. 4. The importance of early diagnosis and treatment. An accurate diagnosis of bipolar disorder is essential for effective treatment. Early diagnosis allows individuals to receive the right kind of treatment, such as medication and psychotherapy, to manage symptoms and reduce the frequency and severity of mood episodes. Mood stabilizers and antipsychotic medications are commonly used to treat bipolar disorder, and psychotherapy, such as cognitive behavioral therapy, CBT, helps individuals learn coping strategies and manage their symptoms. Left untreated, bipolar disorder can lead to decreased quality of life, relationship difficulties, job loss, and increased risk of suicide. Key insight: early diagnosis and treatment of bipolar disorder are crucial for reducing the severity of symptoms and preventing long-term complications. Conclusion: bipolar disorder is a serious mood disorder that involves extreme mood swings between manic episodes and depressive episodes. With early diagnosis and proper treatment, people with bipolar disorder can manage their symptoms and live fulfilling lives. Diagnosing bipolar disorder involves a comprehensive assessment, including clinical interviews, symptom evaluations, and careful ruling out of other conditions. Recognizing the signs early and seeking professional help can significantly improve an individual's quality of life and reduce the impact of the disorder on daily functioning. If you or someone you know is struggling with symptoms of bipolar disorder, reaching out to a mental health professional for evaluation and support is an important first step.